Non-Hodgkin's lymphoma is a cancer which occurs in the lymphatics. Lymphatics are part of the bloodstream, and lymphocytes are part of the white blood corpuscles. So cancers which occur in the lymphatics is known as lymphoma. The early signs and symptoms can be enlarged lymph glands in different parts of body. It could be the neck, or it could be in the armpit or the groin, because lymph nodes are present anywhere in the body. Suppose it is a lymphoma, a lymph gland inside the lungs or in between the lungs, then it can cause pressure symptoms there. Sometimes if it is in the abdomen, it can cause pressure symptoms. It can cause symptoms similar to what happens when there is a tumor in the abdomen. So symptoms can be based on where the lymph nodes are enlarged. Other signs and symptoms of lymphomas could be generalized weakness, weight loss, fever. These are all called B symptoms. When they are present, it means that the lymphoma is in slightly higher stage than the early stages. There are two peaks in lymphoma actually. Lymphomas can happen in any age. It is one of the cancers which can happen in very young age, as well as very elderly stage and in the middle age. So there is no age which is an exception for lymphoma. And the types of lymphomas which occur in children are slightly different from the ones which occur in the elderly. Non-Hodgkin's lymphomas are one of the most curable malignancies which we have. You can say roughly that almost 70 to 75% of all lymphomas can be cured with first-line therapy. This is regardless of the stage. This we cannot say in other cancers. Even in a stage 4 disease, we are talking about cure rates of 70% in a lymphoma. That is the first takeaway from there. But that does not mean that there cannot be relapses. So the relapse percentage depends upon the type of lymphoma, the type of treatment that the patient gets, and also the first line response which the patient gets actually. We can't say that we can avoid a lymphoma because it is not a cancer which is a lifestyle related cancer. It is not associated with smoking or alcohol or anything else which are usually associated with other cancers. But there are certain things. There are at least 10 to 15% of the lymphomas which are actually caused by certain infections. For example, bacterial infections, viral infections. There are endemic lymphomas which occur in places where certain viral infections are endemic. So these are things which can be avoided. And also we can help by getting attention early and getting awareness about this disease, which is highly curable. Lymphomas are one of the cancers which can be cured completely in any age and in any stage. We should never shy away from treatment if you are diagnosed with a lymphoma, regardless of what is the stage of disease. And most important is the first line therapy. So we should not neglect, once we have a diagnosis of lymphoma, we should not wait and watch or try to do some other therapies which can actually make the disease reach a situation where it cannot be cured.